the Adventist Healthcare and You podcast. I'm Shanna.
And I'm Nimit.
We are back with our next episode, and we are really happy to welcome back Dr. Marissa Leslie. Welcome back, Dr. Leslie.
Thank you.
She's one of our return guests. We just really wanted to keep delving into the topic of mental health. So we are happy to have you back. As a reminder, Dr. Leslie is the System Medical Director for Psychiatry here at Adventist Healthcare. And your specialty is adolescent mental health, correct?
Yes, child and adolescent mental health.
Okay. So with so much going on in the news these days about kids and their mental health, the increasing rates that we're seeing, we really wanted to have you back and talk to us a little bit about how we can understand this better and some tips to help our families.
Well, I think one way to understand what's being called an epidemic in an adolescent mental health crisis is, well, one, I think the normalization of mental health and having more honest conversations around it, but also the increased isolation that the pandemic brought on with virtual schooling and people not socializing as much and teens being drawn to social media more as a way to connect. That has created its own set of problems. With teens being on social media more, they're looking at pictures, especially on Instagram, comparing themselves to other people. And whereas before, in previous generations, you could go home and stop comparing yourself to the most popular cheerleader at school or the star football player. But with social media, it's always in your face. And you're always wondering, do I measure up? Am I cool enough? Did people like my post? So that normal self-evaluation that teens go through is just being amplified and not in a healthy way.
I guess before social media, people were getting compliments and that was their validation for self-confidence, I guess. Now, I know with social media, I was reading an article that says, the number of likes kind of measured how happy they were. And if they didn't get enough likes on, certain social medias, that means that they may be more depressed, or the dopamine receptors were more active when they were getting more likes, or they were seeing that they were getting more likes on social media.
True. And I think another thing that happens when teens engage on social media too much is they're not doing things that are super healthy, like running, being outside, reading, socializing without technology. I think that's the other important key to remember. I'm not trying to villainize social media, but I am saying that there's a lack of other things that are truly important for healthy, emotional, physical, spiritual health.
I think it's similar to physical health, right? Where yes, there's ice creams and there's chocolates that you could indulge every now and then, and no harm done. Similar to social media, you could indulge every now and then, but when people are doing it for hours or are investing and then can't stay without it. I mean, I know many people who can be without their phones right there and are looking at every notification they're getting and are expecting that too. And I think that's just amplified with the adolescent population now.
I was going to say the same thing. It's all about balance, right? In our physical health, we have to work towards balancing what we eat and exercise and self-care and all of that. And it's the same with social media and the things we enjoy. It's about balance.
It's about balance for most. And I think for some, they should actually stay completely away from it because it's designed to keep you hooked and to keep you scrolling. And it just gives you more of what you're interested in because of algorithms.
Yeah.
So how has legislation helped with keeping social media in control for teenagers?
It's really fascinating. I'm still trying to keep up with the various laws that are being passed or proposed in different states. There are laws that want to provide more control for parents or caregivers to oversee what they're consuming, kind of like a driver's license. Some states are saying you need to be a certain age if you want to have a social media account, and others are saying you need to have parental permission to have a social media account. I can think of California as one of the states.
I think people can monitor how long you're on social media as well, if you're on for 15 minutes or things like that as well.
There are apps and different settings on devices that allow parents or caregivers to monitor that, to monitor screen time, to just shut it down after a certain time, to shut off the internet after a certain time. And honestly, I really promote those apps and mechanisms because then it decreases the tension. If you're going to ask your youth who's scrolling on a device and using an app that's designed to keep you scrolling to stop, that's super tough. But if the device just shuts off automatically and the youth knows that, they'll be disappointed. They may not be the happiest camper, but at least you're not having constant tension and arguments over it.
And it creates some structure.
It
too,
does.
Yes. Which, at least in my house, structure helps.
It does. And honestly, I think one of the most effective tools to limit social media use is to fill the time with something else. Have family dinners, go out, have a picnic. Some of the old school stuff is really, really healthy, and youth really want it. They may not say it, they still want their phone with them. It's kind of like a comfort blanket, and they want to keep in touch with their friends outside of school hours. But if they're doing something else, if they're involved in an athletic activity or after school activities, one, it's protective against a host of things, against teen pregnancy, against delinquency. But two, you're just filling the time. You're not saying absolutely not, but you're saying we're doing this instead. This is a part of our family routine.
I think being intentional about it is highly crucial as well. I've been to so many dinners where my cousins who are younger, they're just on their phones the entire dinner, or they're not talking, but they're there, and they're there because
they're not interacting.
They're not interacting, and they're not engaged, but they're there because we had a family get together and we asked them to spend some time with us. But it was, I think, just having that structure. I think what Shanna, you were saying, to help guys, what, let's leave our phones on the other table and then just have a normal conversation. And it's uncomfortable now because it's an expectation, right? People are just on their phones. If you look at every table around the restaurant, like, people are just doing that constantly.
Are you calling me out, Nimit? My phone's here on the table. I'm like, maybe I should just really be quiet and just turn it around.
Well, Nimit, I think that's a really good point. If we're going to ask people to put their phones away, engage them in the conversation. And I think that tends to happen with teenagers. We tell them to do something, but we don't tell them what they should do instead. Or we don't invite them to be a part of the conversation. We just assume they have nothing to contribute, and they have so much to contribute. So instead of just having your teenager and telling them, put the phone away, but then I'm going to have this adult conversation over here and not include you, make it an inclusive conversation. Those are things I found in my personal life to really engage youth. And honestly, we have such interesting youth nowadays.
They have a lot
I'm sure
to
we
say.
did before. They have a lot to say, and
they're smart, and they want to share.
They can help you think differently.
Yeah, absolutely.
Yeah. I've been reading a lot of parenting books because I just had a newborn, like 6 months old now.
Congrats.
But thank you. But one of the things that in the books I was reading was saying that, don't tell them not to do something. Tell them what they should do instead. So, saying, do not touch that. Well, what am I supposed to do with my hands then? Well, you could hold this instead. So, I think it's similar as they grow older as well. Saying, do not be on your phone. Well, what am I supposed to do?
Right.
Yeah.
And as with newborns, teenagers too, they want that time and that attachment. They may show it in different ways, and sometimes that way is go away, but they actually really want connection. And so if you're saying, do more of this, do it with them. I think one thing that's been lost is Thursday family night, TV night. We used to watch shows together. So TV in and of itself isn't bad. Social media in and of itself isn't necessarily bad. I think the key is to try to do activities together.
Yeah.
Have a shared interest.
Yeah, I like that. So I read a recent article, and it mentioned the alarming increase in ER visits for teens that are struggling with mental health. And so we talked about why maybe some of that is we're seeing the signs better. We're talking about it more. What is the right place for parents to help their kids that are struggling? And what are some of the signs we can look for? What are some tools that are out there?
Great question, Shanna. And it is really difficult to navigate. So let me start with, I'm sorry for how difficult it is to navigate the mental health space. It is a work in progress. One place to start, which people may not be aware of, is the number 988. So we have 911 seared into our brains for an emergency. 988 is the mental health emergency phone number. And it's not just the number you call if you want an ambulance to come to your house. It is actually, they have counselors, people who can talk to your teen. It's the replacement for the suicide prevention lifeline, but it goes beyond suicide.
Yeah.
And it could be a good start. There are also online resources to find a therapist. One I use constantly as a clinician is psychologytoday.com to find a therapist by insurance, by state, by issue.
Because that's hard in and of itself to navigate.
Super hard. You can also call your health insurance company, or if you're employed, employee assistance programs can be quite helpful. Sometimes word of mouth too, but that tends to be harder because just because your friend or loved one may have used a therapist or a doctor they trust, I'm almost willing to bet that by the time you get to them, they're full and they're not accepting new patients or clients. But there are a multitude of resources out there. The thing I want to really emphasize is please don't give up. It may be frustrating. Go into it knowing that it's going to take some time to find the right resources.
Okay. So we don't want a mental health crisis to get to that point. We don't, the ER is there and they can help, but what are some signs to look out before it gets there? What can we as parents do to help our kids?
Well, I would say step one, really pay attention to your kids, get to know them. And especially in the teen years, like I said before, they may be telling you, go away, leave me alone, don't look at me. Don't go away, and definitely look at them. Understand who they are, what their patterns are, look for changes. If you notice that they're isolating even more or they are giving up things they enjoyed before, just talk to them about it. And yes, if they won't talk to you, there's someone they'll talk to. Find that trusted adult or even older teenager they can talk to and have confidence in.
And it's okay if it's not you as the parent.
It's okay if it's not you. It's not a sign that you're failing as a parent. That's actually very normal for teenagers not to feel like they can share with their parents because after all, good parents and caregivers set limits and may say, you can't stay out as late.
And it's okay as the parent to ask for that help.
It is.
If they're not opening up to you.
Right.
If they open up to someone else, that's great.
But I find that most teenagers actually want to open up to their parents.
Okay.
Sometimes they don't open up because they think you'll limit their privileges or they think you don't understand or you've never been through this. So if you can share, I had a therapist at this period or I'm getting a therapist, just to go through some stress, to talk about some stress I'm experiencing, then your teen is more likely to, one, be comfortable with finding a therapist and talking to one, but two, to open up to you because now you're being vulnerable and you're showing that you're not super mom, super dad, super grandma. You are also in need of support.
So, there's obviously a stigma against talking about, mental health. We're obviously getting better as a society over the past decade or a few decades, and we've come a long ways, but we also have a long ways to go. Families may not typically have this conversation at a dinner table or, as much as they should. What are some of the pointers you recommend for families to have these conversations, parents to have these conversations with their children? Like, how do they approach that? Because, I have certain families, they don't want to talk about feelings. Like, we don't talk about feelings in this household, right? But what are some of the pointers for parents to start doing this and sustain it?
Well, I would actually say practice first. Because a lot of the language we use as a society to describe mental health has really been stigmatizing. Words like crazy or sometimes honestly even help, even though it is help, we do need help. But when you're vulnerable or questioning, American society really promotes independence and I can do it. And I think just starting with it's okay to not be okay, honestly.
And there's a strength in that. I always feel like that too.
Yes, being vulnerable is okay. And one that's really hard for most parents, I would even say this parent talking to you, is when youth have an outburst and then we automatically want to say you're not being respectful, tone it down. Sometimes you can just say, hey, this is a bad moment. Take a minute.
Yeah.
I'm here to listen to you. It's clear. Maybe you can just describe what you're seeing. It's clear you're upset right now. It's okay to be upset. I want you to be safe. When you feel ready, let's talk about what's at the root of you being mad.
Yeah.
And that is revolutionary because most parents just want appropriate behavior. But truly, what you said, Nimit, being families, you don't have to be the most touchy-feely family, but just identifying that feelings are actually okay. We all experience them. And if we don't express them, they will come out in one way or another. And we just want it to be in a safe and healthy way.
Yeah. I've said that a few times when my son has had like an outburst or something. I was like, you're having a lot of feelings right now. Let's just, you're having a lot. Let's just sort through. let's take a breath and
Right.
you take your break and then come back when you're feeling better
Right.
and we'll talk.
And then also as parents, you can identify, you get to know your children.
Yeah.
If you know that your child really needs a snack after school, or your teenager really needs to not be put out in the spotlight because they're more of an introvert, then try to help your teen manage those situations, and also give your teen a lot more autonomy. Because how can they be good, healthy decision-making adults unless they start practicing as teenagers? Ask for their opinion more. Stop telling them what they're going to do, but give them options that you curate, that are safe options. Don't just let them run wild, but give them more options and give them more of a voice, and you'll see different results.
I like that. I've seen this tip a couple times as I've been reading over the last few months, and it's more when you want to have a crucial conversation like with an adult, but I can see it working with kids and adolescents and teenagers too, is make sure everybody's in a good space, like make sure everybody's not tired, well fed, that, they're in a space where they're not already in some sort of mood or, in a deficit, so that it doesn't go off the rails.
That's great advice, Shannon. And it starts with you as the caregiver, as the adult. Your kids are watching you. So if you're running on E all the time, you're cranky, you're not taking care of yourself, you are the example. So you can't give from an empty vessel. Fill your vessel first, and then be there for your teenagers who desperately still want you despite their go-aways.
Yeah. Is there anything else, Nimit, that we have that we want to ask Dr. Lee?
No, Dr. Leslie, is there anything you want the listeners to go away with from this podcast?
I learned this in my training, that we look at adolescence as a very turbulent time. I'm encouraging all of the listeners and us in this room to look at adolescence as an exciting, interesting time of growth that can be challenging to overcome, but not impossible. And so if your teenager is really, really struggling with drugs or with cutting themselves, that part is not healthy. You can get support for that. But there are other parts that may be challenging, but really, once you kind of peel away, can be really interesting, and listen to them more. Adolescence does not have to be turbulent.
Okay.
I think
like
a lot of
that
it comes out from like time and patience, like, just as you said, peeling the onion, like, a little bit more each day, each week, just taking another layer and just being patient about that too. It's beneficial.
And I like the advice too of listen to them. They have a lot to say. We just have to be open to hearing it and learning from it. And just like when we meet new people and we get to know new people, they're growing and changing so fast that they're changing too. And you kind of have to keep getting to know them.
Yeah, be curious without judgment.
Yeah,
And
exactly.
really, for a full minute or more, just don't say anything. Just listen.
Okay, I like that. Well, thank you, Dr. Leslie. We hope you'll come back again, because we had our 25th episode anniversary a couple of weeks ago. And both Nimit and I said we want to talk more about mental health. We know that that's a topic our listeners want to hear about. As you mentioned earlier, it is hard to navigate. So we want to talk more about it. So we hope you'll come back.
Always happy to.
Thank you. Well, thank you to our listeners. If you want to learn more about Adventist Healthcare, visit AdventistHealthcare.com. Also, don't forget to subscribe to the podcast so you get all of our new episodes. Thank you and be well.